So let's shift now to talk a little bit about some examples. Globally, the number of projects that use mobile health technologies has proliferated dramatically over the past decade. We've seen not just dozens, but hundreds, if not thousands of projects that have used mobile technologies to either strengthen their workforce, improve data collection, access clients, or improve the speed at which information is passed from one level of their program to the next. I like to think about this really as three layers of a cake. The first layer is really focused on the client. So how can we develop strategies which target the client in a health system? The second layer on top of that is, of course, the provider. What kinds of strategies do we have available that can help improve the functionality, the self-efficacy of the provider of healthcare within a complex health system? The third layer of this cake is the system itself. What are the digital health strategies that help strengthen the architecture, that help strengthen the pipes which the client and the provider both rely on in order to provide care in this population? So one example of client-specific services or client-specific digital health strategies can be illustrated by the MAMA project. This project was inspired by a project that was used here in urban areas of North America called Text for Baby, where pregnant mothers would receive gestational age-appropriate messages at various time points within pregnancy about behaviors, foods, health conditions, danger signs to expect during that pregnancy period. Now, as I mentioned earlier, you recall, information a decade ago was the privilege of just a few elite members of societies around the world. But now to make this information commonly available to people who need it the most, in this case, pregnant women, had the potential to be very transformative. So in Bangladesh, South Africa, India, and other countries, USAID and other partners that included private sector groups like Johnson & Johnson helped to develop and launch this service to provide free or subsidized messaging to pregnant women in these countries. Now, the proof in the pudding of success of this kind of strategy is that both South Africa and India have integrated this strategy as a component of their national health system, where every pregnant woman is now able to subscribe to these services and receive messages. But this has taken it one step further, using this platform as a way of connecting mothers to actual physical services, not just virtual information and communication interventions. So a really exciting trajectory that has been experienced by this kind of digital health program in a mere span of 5 years, which is quite rapid in the global health space. When we think about targeting the workforce, there are programs that allow health workers to use mobile devices, simple non-smartphones to complex smartphones, to do things like this, where a health worker can use their phone to simply tap their screen every time they see a baby breathing, and that automatically calculates the breaths per minute in order to assess whether a child may be suffering from a respiratory illness such as pneumonia. Other tools like this set of cards developed by colleagues at BBC Media Action allow frontline health workers to deliver consistent health messages to their clients by simply dialing a phone number located at the bottom of each card. And this allows a third-party authority voice to convey a message about specific health practices or health-seeking behaviors, allowing the health worker to really serve as a focal point for discussion around that specific topic. This is fantastic, especially if you have a topic that's extremely sensitive or socially unacceptable. So you can have a third party broach this difficult topic, and then you, as a health worker, can initiate a conversation about what the doctor on the phone has just said, leading to an open conversation. So innovative ways of challenging problems in information and communication that have been faced by health systems. As I mentioned earlier, one of my favorite examples of system-targeted interventions are those that help reduce stockouts. One example shown here by the Novartis group called SMS for Life allowed frontline pharmacists to send a single text message at the end of the day with the specific numbers of bottles of anti-malarial drugs remaining on their shelves in their rural pharmacy. Now, this structured text message allowed the stock units to respond to impending stockouts before an anti-malarial drug actually ran out in a rural facility. This has been evaluated in a number of studies, but to me, the graphs of performance are fairly dramatic. When you see that over a period of several months, we see stockout levels go from 15 to 20%, sometimes even 60%, down to a handful of facilities which are experiencing stockouts, sometimes even as low as 1 or 2% at the end of the intervention phase. So again, a simple text message could be transformative to this vital function of a health system. Other programs such as UNICEF are leveraging the social media capacity of these new technologies. So in many countries, places like the Philippines, Uganda, Twitter and Facebook are used even in rural populations where we would not have imagined a technology like Facebook to be used 5 or 10 years ago. U-Report is a way to engage their populations in commenting about health services and government functions in a way that's transparent, allowing the population to provide feedback to the ministries of health in terms of how they are performing in the delivery of goods and services. It's important, however, that we learn from successes and failures. Very often in public health in general, we hear about successful programs where failed programs don't find the platform or the attention that they actually deserve. I think building on each other's work, learning which strategies have worked in which context and which have not, is absolutely critical to not wasting valuable resources in recreating the wheel, in trying to solve problems one way or another. I think we are beginning to see in this fourth era that I talked about earlier, integration and scale, where countries are actually learning from their neighbors and adopting common strategies and approaches to try and solve these problems. Some of you may have seen this famous slide by a friend of mine, Sean Blaschke, working for UNICEF in Uganda. Jokingly, we refer to this condition as pilotitis, the uncoordinated proliferation of projects across the country where programs adjacent to one another might be doing very similar things, but using very, very different approaches that don't ultimately speak to each other. So I think the future of where this is going is not so much a disconnected system, but working towards a connected ecosystem where we see the same map of multiple projects superimposed on the map of Uganda, but rather than being disconnected and separate, the adherence to certain standards allow these projects to speak to one another, sharing information across common backbone platforms, such as DHIS2 shown here, aiming for that goal of interoperability, which means not just better functionality for the health system itself, but as a patient, as you move from one hospital to another, or even across districts, for information to be transferred seamlessly from one place to the next. A dream that we, even in the United States, have not yet been able to achieve as we move from one hospital in Baltimore to another, where we still have to request printouts and paper and CDs to port our data from one place to the next. So maybe Uganda will actually reach a level of interoperability long before we do here in high-income countries. One model that's often cited is this one called the Open Health Information Exchange, where multiple services, so like I mentioned earlier, we see at the bottom a variety of services, client registries, shared health records, health management information systems, health worker registries, facility registries, all these different modules. And on the top side, different points of service, apps that might work for doctors, nurses, community workers, all being able to connect to each other through an interoperability layer that is curated by the government of that particular country. Now, this kind of a model is increasingly being looked towards as a gold standard for setting up new digital health systems in emerging economies. As we look towards the future of innovation, we also have to go beyond health alone, because we talk about mHealth and digital health, but actually digital is everything. Mobile is being used for multiple verticals of life, whether we're talking about health, agriculture, finance, education. Mobile telephony has enabled and optimized services in each of these vertical domains. For example, the ability to transfer financial resources using mobile phones is something that's done across much of the global south in today's world. In places like Kenya, you can go to the market and buy fish or rice with a system called M-Pesa, which allows you to transfer a cash balance that's on your phone to the vendor without any transaction whatsoever. Now, if you're a pregnant woman running to the hospital for emergency obstetric services, the ability to request money from friends and relatives, or even from an insurance scheme you might be a member of, is transformative. That you can have access to digital cash assets with a simple text message is fundamentally life-changing. We also have to be inspired by technology as it's being used in the wild, so to speak. And one of these technologies that just a few months ago I was in the field in rural Bangladesh, and I observed our health workers exchanging these little pieces of technology. Some of you might recognize this as a micro SD card. Now, what a micro SD card is a small storage device the size of your thumbnail that can hold the equivalent information of up to 500 or 600 CDs or DVDs. Now, imagine being able to transfer that volume of information on this tiny little device that can be read on a smartphone or a feature phone. In these communities, this is being used to share Bollywood movies. What if we were to harness this technology to share health training videos or other libraries of information? That too could be potentially transformative in terms of allowing access to information for every single citizen. So these are just a few examples, and there are many others available to you at websites such as jhumhealth.org or at this website called mHealth Evidence or mHealthKnowledge.org, where we've helped the K4Health Project and the Center for Communications Programs here at Johns Hopkins compile thousands of resources by specific category for students and faculty interested in learning more about digital health technologies.